In February 2025, a video surfaced online that sent shockwaves through Australia. It featured two nurses from Bankstown Hospital in Sydney, Rashad Nadir and Sarah Abu Lebde, engaging in a video chat with Israeli influencer Max Vafer. The content of their conversation was deeply disturbing. Abu Lebde was recorded stating she would kill an Israeli patient. Nadir was seen making a throat-slitting gesture and using expletives. The video quickly went viral, sparking outrage and condemnation from the Australian public. The nurse's actions were a stark reminder of the insidious nature of anti-Semitism, rearing its ugly head in a place where compassion and care should prevail. This incident was not just about offensive language, it was about a direct threat to the safety and well-being of patients based solely on their nationality. NSW Health Minister Ryan Park wasted no time in condemning the nurses' actions. He described their behavior as vile, disgusting, and deranged. Park assured the public that a thorough investigation would be conducted. He promised that if the allegations were confirmed, the nurses would never work for NSW Health again. Prime Minister Anthony Albanese echoed these sentiments, calling the video sickening and shameful. The gravity of the situation was undeniable. The incident struck at the very heart of Australia's values of tolerance and respect. It also raised serious questions about the safety of patients in the care of healthcare professionals who harbor such hateful views. The incident left many Australians wondering how such blatant prejudice could exist within the healthcare system. In the aftermath of the video's release, both Nadir and Abu Lebde were swiftly suspended from their duties at Bankstown Hospital. Their defense, however, painted a somewhat different picture. Abu Lebde's brother claimed she was baited by Vafer. He argued that the video was edited in a way that removed crucial context. He cited his sister's distress over the loss of 70 family members in Palestine as a mitigating factor. Nadir, on the other hand, claimed his comments were meant as a joke. He maintained that his words were a misunderstanding and that he intended to apologize. However, these explanations did little to quell the public outcry. The damage was done. The video provided chilling evidence of a deeply ingrained bias. The nurses' attempts to downplay their actions as jokes or misunderstandings rang hollow for many. The incident highlighted the dangers of casual bigotry and the real-world consequences of unchecked hate speech. The response from Bankstown Hospital and NSW Health was immediate and decisive. The hospital took down pro-Palestinian social media posts, citing a breach of policies against political content. NSW Health Minister Park sought to reassure the Jewish community. He promised continued first-class care and announced a review of past hospital records. These actions demonstrated a commitment to addressing the situation transparently and restoring public confidence. The incident served as a stark reminder of the importance of maintaining a neutral and inclusive environment in healthcare settings. It highlighted the need for ongoing education and training to combat prejudice and discrimination. The safety and well-being of patients should always be the paramount concern, regardless of their background or beliefs. The shocking incident at Bankstown Hospital did not occur in a vacuum. It unfolded against a backdrop of rising anti-Semitism in Australia. The 2023 Israel-Hamas war had fueled a surge in anti-Semitic attacks and rhetoric across the country. Vandalism and arson attacks on Jewish targets became increasingly common. Jewish leader Alex Rivchin spoke out about the growing extremism among medical professionals towards Sydney's Jewish community. The nurse's video was a chilling testament to this disturbing trend. NSW police launched an investigation into the incident, exploring potential hate crime offenses. Hate crime officials in Sydney and Melbourne were also investigating related anti-Semitic crimes. These included a trailer filled with explosives and a list of potential Jewish targets. The police requested the full, uncut video from Vafer as part of their investigation. The severity of these related incidents underscored the need for a comprehensive approach to tackling anti-Semitism. The incident at Bankstown Hospital exposed the vulnerability of minority groups to prejudice and discrimination, even within institutions meant to provide care and support. It brought to light the urgent need for greater awareness, education, and action to combat anti-Semitism and all forms of intolerance. The investigation into the nurses' actions was not just about holding individuals accountable, it was about sending a clear message that hate has no place in Australian society. The nurses' actions had a profound impact on public trust in healthcare professionals. The incident eroded the confidence of many Australians, particularly within the Jewish community. The idea that healthcare workers could harbor such prejudices was deeply unsettling. It raised concerns about whether patients from certain backgrounds could receive impartial and equitable treatment. Rebuilding trust became paramount. The incident served as a stark reminder that prejudice can manifest in any profession, even those built on principles of compassion and care. It highlighted the importance of addressing hate speech and discrimination wherever they occur, regardless of the perpetrator's profession or social standing. The ongoing police investigation and potential legal consequences for the nurses were crucial steps towards accountability. Holding individuals responsible for their actions sent a powerful message that hate speech has real-world consequences. However, addressing the root causes of anti-Semitism required a broader societal effort. Education, dialogue, and promoting understanding and tolerance were essential in combating prejudice and fostering a more inclusive society. The incident at Bankstown Hospital, as shocking as it was, presented an opportunity for Australia to confront anti-Semitism head-on and reaffirm its commitment to a just and equitable society for all.